Okay, we will get started. In your handouts or in your notebook, you do have the PowerPoint listed there. Some of the things that we're going to talk about sort of briefly, a little bit about what is public health, a little bit about the history, but I promise you not a big history lesson, just a snippet of history. What do we mean by the public health approach? What are the core functions of public health? And then who are those individuals, those stakeholders that work in public health? And then what are some of determinants of health, okay? And then after the course, hopefully you will be able to describe, define, and identify some of the things that we've talked about. And maybe if you missed a question in the quiz or something, hopefully it might get answered this afternoon. We're going to start off with, it's about a 3-minute video. This was developed by the American Public Health Association, and the narrator is the executive director. His name is Georges Benjamin of APHA. And again, if you want to use this, it's available online. See if we can make this work.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
A little bit about some definitions and some key terms. You probably were familiar with a lot of the terms that we just saw in the video. And as they describe, public health is so broad and it encompasses so many areas. It covers all kinds of health conditions. It covers our environment, covers what we eat, physical activity, And during our introductions, a lot of you are working in some of those areas, it sounds like. I want to point out a handout, and it should be right behind the PowerPoint in your binders. Okay. And it starts off Three Sisters. And I wanted you to have the handout, again, so you can utilize this story if you want to, at some point. But here's a little story. Three sisters walked along a riverbank and saw babies in the river, helpless and struggling. The first sister, distraught, jumped in and tried to rescue them. The second sister, resolute to save them, jumped in the river and tried to teach them to swim. After looking at the scene and what was going on, the third sister walked away. Confused, the other two sisters called out to her and said, "Where are you going?" She answered, "I'm going upstream to find out why the babies are floating in the river and why to stop it." Okay. Have any of you ever heard that story before? There are several versions of it. Talks about, nurses standing there, just three friends standing at a river. And this one was available, I saw this using the Three Sisters. But it really does explain public health. So why did that third sister want to walk upstream? Anybody? Pardon? For prevention? Yeah, find out who's pushing those babies in. Let's get this stopped. So walking upstream to look at what are the issues going on? Why is this happening? Okay? How many of you find yourself asking yourself these kinds of questions? Maybe things you see in the clinic or you see in your community, and you wonder, why is this happening? How many of you feel like you're investigators sometime and you go out and you try to find what's really going on? And how do you do that? Do you talk to other people? Look at data? Call the health board? Say, hey, what's going on? Tell us the statistics you have in this area or that topic. Right.
It's on Facebook.
It's on Facebook, yeah. Okay, so sort of a formal definition was developed by a man named Winslow. It was Charles Edward Amory Winslow. And this is from the 1920s, but it's still a very relevant definition today. And you still see it in all of the public health textbooks. But he says it's a science and art of preventing disease, prolonging life, promoting health, through organized efforts and informed choices of society, organizations, public and private communities, and individuals. So lots of ways that we are getting this, that we are accomplishing all of these efforts. And notice that he called it a science and an art. What do you think is the art part of public health or health promotion? How is that an art? Anybody? Don't make me do all the work. I need participation. A tool, okay. What else? Not one thing works every single time, right? Personalities come into play. Maybe how you deliver a message. You can deliver the same message, in a variety of ways. But as I said, the definition is still very relevant today. The mission of public health has been defined by a lot of national organizations. The Institute of Medicine says that it's fulfilling society's interest in assuring conditions in which people can be healthy. And the World Health Organization, of course, is talking about affecting a larger number of people. In the 1980s, it seemed like public health was taken for granted. We had most of our vaccines developed, a lot of attention drawn to sanitation and clean air and things like that. So during the 80s, it seems like the attention to public health sort of went by the wayside. So the Institute of Medicine was one organization that stood up and started to do more education and talk about their mission. One of the things that prompted that was the AIDS epidemic, about the, what was that, 80s and 90s. So a lot of attention drawn to that, and then what to do about the epidemic, how could it be prevented, how to provide education, and so forth. And then other issues became very prominent, such as teen pregnancy, substance abuse. And then in 1988, the future of public health was a document that was written, and you can Google that document, it's very interesting. But it caused a revitalization of the field and a lot more attention. I think a lot more degree programs were developed, more individuals interested in getting degrees in one of these fields of public health. And we'll talk about some of those fields here in just a little bit. There are so many key terms. This is just a couple really quick. Clinical care, we know what that is. Basically, how is clinical care different from just general public health? Typically, we say prevention, although hopefully in clinical care there's prevention occurring. Determinant, that's looking at all of those factors that affect our health, and we'll go into more detail in just a minute on what some of those determinants are. And epidemic and pandemic, those are words that we're hearing a lot these days. Just quickly, does anybody know the difference between epidemic and a pandemic? We're coming out of the COVID pandemic, right? So what does pandemic mean? It affects a large area of individuals. In fact, a pandemic, as in the COVID case, covered the entire world almost. And then an epidemic is usually an outbreak, such in a particular region or an area or a community, and it's dealt with more on the local and state and regional levels. And then health outcomes, these are things that we write about in our grants. How many of you are responsible for writing grants for different health issues? And a lot of times they ask you, what are your health outcomes? What are you looking for? Well, health outcomes don't occur in a 6-week physical education program or physical activity program. Outcomes takes years. If you're doing tobacco cessation, again, you're not going to see outcomes in 6 weeks or at the end of one class. We're talking usually years down the road. And it takes a long time to look at health outcomes and to see, those kind of improvements. Okay. Next, just a little bit about the history of public health. Let me ask, any epidemiologists in the room? Trained epidemiologists? Because if you are, you probably know this story. Sanitation, environmental health, that's not new. That's something that's been around forever. The ancient Romans and the Greeks knew about water safety and sanitation. If you've ever traveled to some of the areas, you can see the structures that still stand for drainage of water and so forth. So they didn't know exactly what was happening, but they knew there was that association. If there were sewage or unhealthy water, they knew it caused something. Okay. The Public Health Act of 1848, this was something that was started in London, and it's one of the first, I want to say, sort of regulatory boards that established a health board to look at, in this instance, it was water safety. I'll give you an example in a second. And then, of course, the 1970s, we have the EPA, Environmental Protection, we have OSHA. What are some other things more present day since the EPA? Clean Indoor Air Acts, what else? More attention to secondhand smoke and the dangers. We know more about lifestyle. So a lot of public health agencies have sprung up for that. Back on pandemics again, one of the first ones sort of recorded was the influenza. Some of you might have heard it called the Spanish flu. And it just killed hundreds of thousands of people, millions of people. And it was considered a pandemic because it was so widespread. And nowadays with influenza, how many of you get flu shots? You see them, you know, the availability or the accessibility is usually there. It's readily available. So a push these days, excuse me, for to get your flu shots, the COVID shots, of course. And then polio, this was probably before any of your days, but polio used to be a real public health problem. And in textbooks, there were always pictures of what communities did in those days, and this was the 1950s, I believe. Communities knew, they didn't know exactly what was causing polio. They didn't know if it was spread person to person, but it seemed to appear in clusters. So small towns closed down their theaters, their parks, sort of reminiscent of some of the COVID days. And eventually then a polio vaccine was developed, and it still occurs in the world, but for the most part it's basically being eradicated. Same with the measles vaccine. The measles vaccine came out in the 1960s, mid-60s, and by all authorities, they wanted to eradicate and thought they would eradicate measles. But we still have outbreaks here and there. Why? Why do we still see measles? No vaccinations. And some controversy, some parents choose not to. There's a lot of research. There might be some side effects, some dangers, and so some parents choose not to. But if you do read the literature, the side effects of getting measles is much more severe than any side effects that you might get from a vaccine. And that's what the literature says. Okay, if we look at public health in terms of some major disasters that have occurred, again, it goes way, way back, like when was this, 14th century, when the plague, or it was called the Black Death, was prominent. When people were at war, they would actually take the corpses of an individual who died from plague and would hurl it over a wall into a community. Thinking, again, they didn't know anything about, the bacteria or viruses. There were no microscopes at that time, but they knew something was causing that. If they came in contact with that dead corpse, they were likely to get the illness, okay? Then, of course, 9/11, which was in 2001. A lot of public health surveillance, was conducted after that. A lot about clean air, respiratory health, the list goes on and on there. And then other tragedies like Hurricane Katrina. We've had wildfires recently. And, they were talking about, even in Oklahoma, just the quality of the air from all of the Canadian wildfires. Y'all remember that? And some of the larger cities closer to the Canadian border were even, they went back to mass because of the consequences of respiratory ailments, after inhaling all that kind of air. And just a quick story, and I noticed one person said they're in preparedness. Was that you? Who was in preparedness? Emergency management, that was you, okay. Have you heard of, in the state of Oklahoma, Item C, Intertribal Emergency Management Coalition? Just a quick story, and are you familiar with it? Do you attend their meetings? All righty. Do you know how it got started? There was a man who was an emergency manager for the Kaw Nation. Everybody know the Kaw Nation, kind of north, a little bit to the east. Anyway, he was the emergency manager for the tribe, and there were a lot of things going on. Rapid water, what do you call them? Rapid water safeties, getting people out of flooding, the wildfires, and so forth. And he saw the need to organize all the emergency managers from the tribes in Oklahoma. And at that time, one of the centers that Mr. Barton mentioned was one of the centers that I was working with. So we had money to fund it. And we said, hey, we can give you money from the grant, let you use it however you want to use it. Use it to rent space, send out flyers, but get a group together. So, and of course we assisted with that and called a meeting. Well, only like 2 people showed up. Well, he didn't want to give up. And so the next month announced it again. And every time a few more people would come until finally we would have a room full of people, 40 or 50 people. And most all of the tribes represented from Oklahoma. And then they expanded a little bit to Kansas and Texas. But it was a slow start. They wanted to call themselves a coalition, and they started out the typical stories, one man, and today they're a 501c3 and still carrying on the meetings. The individual that started it, he has passed away, but there have been others. I know the Osage Nation's very prominent with Item C, and the Potawatomis and some of the others. So that's a nice success story of just a coalition in the tribal community. Saw a need. One man said, we're going to make this happen. And just with a little bit of funding, like I said, they're now a very active organization, and they even hold their own conferences these days. Okay. Public health prevention through policy. And what we're doing is looking at public health through different lenses. We had talked about preparedness or disasters, the pandemics, and environmental health. So the 4th lens here is prevention. And again, as early as the book of Leviticus, there are things mentioned in there about body cleanliness. They talked about leprosy and just, again, not understanding how it was spread, but they knew contact was important. And then in the 1960s, a lot of tobacco laws became prevalent. Now we see no smoking in restaurants, still working in bars. How many of you have smoke-free campuses where you work? Anybody? Oh, some of you do? Okay. How difficult was that? Was it hard to convince people to have a no-smoking campus? Was very hard. Yeah. Right. Yeah. And how many of you also provided ways to stop rather than, here's the policy? Did you start out with cessation classes, access to the pharmaceuticals and so forth? Good. Because it's very difficult to enact any policy, especially related to health, if you don't provide those resources to make that happen. How many of you have like physical activity breaks at work? Or you have a policy, you know, how long do you get? Or is it at your own discretion? Encouraged to get out, walk, stand up, move around, that kind of thing? Okay. How many of you have ever tried to get a resolution passed by your tribal council on a public health issue? Again, easy? Not so much, yeah. One of the best ways is be prepared, you know, and if you can get data from your own community of what's happening, the number of illnesses that maybe have occurred or disabilities, whether it's diabetes, you know, whatever, just be prepared. And there's a lot of literature out there, how to approach your tribal leaders, how to convince them. You know, it's not just your personal opinion all the time, but back it up with some numbers. And again, the health board can help with that. They have all kinds of data on just a variety of public health topics, and some of it by region. They don't always have tribal specific because tribes, in some instances, are so small, You can't really generalize. Okay. And then something that's fairly recently, do any of you remember hearing on the news, New York City a few years back tried to ban any sodas larger than 16 ounces because they were worried about an obesity problem in the city. Do any of you remember hearing that on the news? I don't think it worked very well. It wasn't terribly thought out, you know, in a good sense that people would adhere to it or even want it. So there have been a lot of other things they could have done to address obesity, you know, in a large city. So if you do policies, you've got to do your homework and have a lot of information to back up, you know, why. Okay. Next, a little bit about a public health approach. And there's about four areas here quickly that we'll go through. So when we talk about a public health approach, there's usually four areas: the surveillance, identifying risk factors, how can we intervene, and how do we know what works and what won't work. So intervention, where we use really good sound evaluation, and then implementation. So to start out with surveillance, what do we mean by surveillance? Well, basically, what is the problem? And you will a lot of times use surveillance to find out what that problem really is. How many of you are mathematically inclined? Love statistics. Anybody? Me either. It was my worst class in school. I hated it. But now I appreciate it. And I appreciate those individuals who provide all this information for us. But rather than sometimes just saying X number of people have diabetes in our community or in our tribe, if you can work those numbers down and say 1 in 3 people, or if it's breast cancer, rather than saying, 2,000, 3,000 women, say 1 in 3 women will get breast cancer in their lifetime. So when you break it down, 1 in 3, or you compare, I know with tobacco deaths, they compare that sometimes to a jetliner. If a jetliner goes down and it kills 200 people on board, we stop, we listen, oh, what happened, where was that? And, but yet we'll have that same number die, say in a community or a state of Oklahoma, from one complication. But it doesn't get our attention necessarily. But if we say 1 in 3 or 1 in 4 women or 1 in 5 children, and there again, you have individuals at the epicenter, tribal epicenters, that can help you sort of massage those numbers and get them to mean something to your community. Kind of veering off the topic here a little bit. But then we use epidemiology. What is the cause? After we identify a problem, what are those risk factors? What's causing it? Is it access to fresh foods? Is it lack of physical activity? Is it substance abuse? And we're hearing so much these days, all the fentanyl pouring into the country and the dangers, and that's another whole topic, how to address that. But if we can find out what those causes are, then we can start thinking about what are some of the best practices, the interventions. What's going to work? What won't work? And a lot of times you can look at the literature. You don't have to reinvent the wheel, on especially a public health program. There's jillions and jillions of programs out there. One of the terms we like to look for, what's best practices? And if you look on the CDC website, and there's even a tribal support unit, and they are in the process of developing a portion of their website that's tribal specific. And I think it's up, but it's not fully done yet, but you might watch for that. But you can always take a program or look at best practices and then adapt it, for your tribe, for your community, for your population. And sometimes things might work for adults and you go, well, will this work for kids? Tobacco cessation classes that adults typically attend. Does that work for kids? Not necessarily. So we've got to figure out what's different with kids. So what is it with kids? Is it more peer pressure than with the adults? The adults, they've probably been smoking for years and it's their habit. Kids, we try to prevent it in the first place. So if we can prevent the initiation, hopefully they don't become adult smokers. And then you'd want to find out the best ways, and I'm forgetting to punch my arrows here. We want to find out what's the best way to do a program. Is it educational based? Is it going to be activity based? Where are we going to have it? What time of day? All those things are factors. Parking, is there going to be parking available, if we're going to have a program? Anybody here from the Northeastern tribes, Northeast Public Health Center? I can't remember exactly which tribe it was, but in our Good Health and Wellness program, one of our sub-awardees at that time, and I don't think she's with us any longer, but she had a physical activity program and was promoting walking, and they had a walking path even identified, but she found out nobody was participating, so she started asking people, what do you think they said? Why weren't they participating? They didn't know the walking trail was even there. So she went back and did some campaigning, raise awareness, maybe put a map, you go this far, it's a half a mile and so forth. So do you remember some of that, or hopefully it's fully functioning today? Yeah. So, yeah, they just. I don't know who that was, but yeah. But she found out that was very interesting. People didn't know it was there. And you think, duh. So sometimes what seems obvious, really it isn't to all people. Everybody's so busy these days and with kids and on. You don't stop and think sometimes, oh, that already exists. That would make my life a lot easier. So when you're implementing, you really need to talk with the folks you want to participate in things as little, like I said, time of day or day of the week. Is there parking? Is there going to be childcare available? Just on and on. Do we need incentives? And nothing wrong with incentives. There's some pros and cons. We shouldn't provide gifts to people, but everybody likes a gift, right? So I'm kind of all for incentives. If that will get people there, then hopefully they get into the right reasons they're there, and it becomes part of their everyday life. Okay, let me take a sip of water here. These are just some of the core sciences. And I'm going to do one more example, and then we'll come back to this a little bit and talk a little bit more about some of these areas: the surveillance, epidemiology, public health laboratories, and information. The cholera example, I mentioned a while ago that there was a health board established in the 1800s. Everybody's heard of cholera, right? We don't hear about it much today, but if you watch Westerns, almost every good Western, there's a cholera story, right? And what causes cholera? And again, this was before microscopes, early 1800s, but the bacteria in, water that's contaminated. So in the city of London, in about the mid-1850s, there was an epidemic of cholera. And there are a lot of movies made about the city of London and the cholera epidemic. So it's kind of interesting to find one. At first, because they couldn't see the bacteria or anything, there was a horribly bad smell around, water that's contaminated or sewage. And you've all been around a dumpster and you know that smell. So at the time, they contributed color to the bad smell. And they called it a bad smell theory that was making everybody sick. They were breathing that air. Well, scientifically, it was called the miasma theory. M-I-A-S-M-A, miasma theory. And that was a name given to the bad air theory. So John Snow, that we mentioned a little while ago, he set out to disprove that theory. And this is him. He was a physician in London about the same time. And he had a different opinion of cholera. So he knew that the illness, or he thought very convincingly, that it was spread by way of the contaminated water because sewage was routinely dumped in the rivers around London, especially the Thames. And nobody thought anything about it. So he thought surely there's a connection. So at that time, he started tracking down the source of the cholera outbreak. And because of this, he is considered the father of modern epidemiology. So that's why I said if you're in epidemiology, you will know this name. But what he started doing was he talked with people. The families that were sick with cholera, he would go and visit. He would go and visit, and he said, I'm just going to plot where all these cases of cholera are. And see what's in the red circle? That's sort of the concentration of where the cases were occurring. So he was doing surveillance, okay? He went out, he looked at where the people with cholera lived. He wanted to find out where they got their water. So he did this by involving the stakeholders, the citizens there. And the example is their efforts highlighted the benefits of linking scientific inquiry with the engagement of the community stakeholders. And so he went a step further, and he wanted to find out where the actual pumps were, because there were just town pumps, the old-fashioned ones with the handle you see on farms. You know what I'm talking about? So he said, let's see where those pumps are. So the dark black squares are where the pumps were located. And, okay, again, inside that red circle, there was a concentration of the cases nearest that one pump. And it happened to be on Broad Street, so they called it the Broad Street pump. So he concluded that people who were using that pump were the ones getting the most cholera. So people in the outlying areas, sure, there were some cases, but there were no clusters around where the pumps were. Okay, kind of makes sense, right? And today, we call this GIS mapping. Do any of you do this? Are you aware of GIS mapping? You are. And you almost have to take a class to figure out how to use it. And I do know the University of Oklahoma College of Public Health has a class in it. And Nick, there might even be some online GIS classes.
There are in GIS Geographical.
Okay. But it takes a whole semester usually just to figure out how to do this. But it can be used in so many ways, not just to show illness, it can show incidents of anything you want to track. Okay. But anyway, off the topic here a little bit. So this map revealed the largest number of cholera cases in relation to those neighborhood pumps. So he concluded the Broad Street pump was the one that probably was the most contaminated because of the illness around that area. So, what do you think he did? How did he get people to stop using the pump? Do you think he sent out, messages, don't use the pump? Probably wouldn't work. What's the real simple thing? Get people not to use the pump, the water pump. Take the handle off. So he took the handle off the pump, and So, and again, the population not understanding everything believed, okay, there was an association. And so he got them to understand that it was from the sewage being dumped in the river, causing the contaminated water and making everybody get sick. So again, one of the earliest ways that epidemiology was sort of looked at, and again, before the word epidemiology, I think, was probably even invented. So through this research, he was able to stop exposure to the contaminated water and then eventually the entire supply of water in that area. In other words, getting the rivers cleaned up and getting them to stop dumping sewage. And I got a little ahead of myself. How did he do that? He took the handle off of the pump, okay? So that was his intervention. He removed the handle, and then after that long battle with some politicians, the water companies and so forth, citizens there in London, he finally convinced the British government that they had to do something to clean up the rivers, and so they did. A little bit about some of the core functions, and what are those essential services of public health. Right now I can tell you there are 3 core functions, there are 10 essential services, and let's get going. 3 core functions of public health are assessment, policy, and assurance. And just basically what these really are, you can read those definitions, but basically assessment is know what needs to be done. Okay, you've done an assessment and you've figured out exactly what needs to be done. Policy is, it's being part of the solution to get it done, okay? Policy is being part of the solution to get it done. The use of scientific knowledge and just good decision making based on facts or based on numbers. And then assurance basically means making sure it gets done, okay? Just making sure whatever you're wanting to do, making sure it gets done. And then, let's see, yeah. Before we do this slide, I want you to look at a handout, and again, right behind the PowerPoint is the 10 essential public health services. And wanted to leave it out as a handout and big so that you can refer to it, later on. But what you see is the big circle, and it's divided into, you can see around your circles, everybody have that? You see the words assessment, policy, and assurance going around in the circle on your handout, okay? If you look at assessment, you see sort of that orange block and the red block, okay? So we're starting on what are the 10 essential services and how do they coordinate with the core functions. Does that make sense? So there are going to be 10 essential services, but they are divided up according to what do we mean by assessment, by policy, and by assurance. Okay. So under assessment, we're talking about monitoring health, we're diagnosing, we're investigating. Policy, you see the words inform, develop policy, enforce laws. And then with assurance, you see those last 4. The links to care, a competent workforce, evaluate, and research. So this is, excuse me, this is something that, again, you're going to see this in every single public health textbook, those 3 core functions and these 10 essential services. And if you're writing grants or you're doing grant work, a lot of times it's tied to one of these. Either you're surveilling, you're gathering data, you're trying to get policies maybe written, enforced. So a lot of times it relates back to the core functions and those 10 essential services. So I wanted you to be able just to have this and pull it out and have a bigger version than just on a slide. Some examples of how these work at a government level. at the bottom we've got local, state, and then federal. So for example, using tobacco use on a federal level, we have National Tobacco Public Health Surveillance. How many of you have heard of BRFUS? And there's tobacco surveys, telephone surveys, zip code surveys. So we have a percentage of the number of smokers, in the U.S. And sometimes it's broken down by age. And then at the state level, we have that information. And a lot of times on the state health department's website, you can also find some tribal specific data and talk about maybe use, and maybe not your tribe specifically, but maybe a portion of the state, southeastern Oklahoma or northeastern or something like that. And then at the local level, that's just local data. What's going on locally in your schools or in your school system or in your city, the restaurants in your city, and so forth. So just different examples of carrying these functions out at the different levels. Backup examples, federal level, smoking ban on commercial flights, that's been done years ago. Increasing taxes, county laws, smoking in bars, smoking in restaurants, and so forth. So just an example at the different government levels. And before we get into stakeholder roles, functions, yep, we did that. One other handout, you see the public health disciplines, again, this big chart. Yeah. If you'll get this handy, we're going to talk about some of the stakeholders in public health, who some of our partners are, and then we'll talk about the professions in public health. But some of our partners are our community members, clinical care, healthcare delivery, the public health infrastructure, for example, the U.S. Public Health Service. We have CDC, some of the government infrastructures, World Health Organization, worldwide. We have academia, and of course we have the media. And a lot of things can occur in businesses, even businesses like tribal communities or your own clinic, enforcing some policy within just that one business or that one area. Everybody has a role in public health. You have another diagram, I think. Kristen, do you remember, did we pull this one out for a handout or not? It's on the slide only. Okay, in the center you see a tribal public health agency. So who are the partners? Who do we need to be working with to make a healthier community? Well, it's almost endless. It's everybody in the community, all the way to your laboratories, your mental health facilities, maybe working with your local state health department. And I know in some parts of Oklahoma, some of the tribes are working very closely with a county health department if it's geographically in their area. Drug treatment programs, the hospitals, the schools, neighborhood organizations. Again, it's just endless. So it's everybody can be involved in public health and can be these partners. And the heading was left off. This should be called Tribal Public Health Example. And sorry for that we didn't get that heading in there. And then some non-government organizations, sometimes we call them NGOs. There are a lot of professional, like membership organizations, such as the American Public Health Association, the National Indian Health Board, NIHB. There's a state health education program. I think it's called Oklahoma Public Health Association. Are any of you familiar with some of those organizations, or you participate? Their meetings, their conferences. A lot of times they'll have a state conference or a regional or a national conference. How many of you have been to a national conference like NIHB, APHA, some of those. Very interesting, overwhelming, they're so big sometimes, but very, very interesting and great ways to network. Some other NGOs are some of the associations like related to a health event, like American Cancer Society, American Heart Association, even AARP. I know they're a very strong partner with the tribes in Oklahoma. So if you're trying to get things done, all these groups, many times, they have free materials, gadgets that can go in bags, conference bags, pamphlets, little reminders, depending on what the topic is, all kinds of information that's typically free. It's for the asking, and you can have things to pass out in your clinics or in your offices, or if you're doing a program, to say you're doing a group just in your own tribe. It's nice to have some of these little free things that you can hand out. And those organizations are very good at helping out. And a lot of things are also public information, so you can adapt them to your own area. You can put your own tribal name or your logo on a lot of the information, as long as you also, for example, have American Cancer Society, but then you could insert your tribe as well. So you don't have to reinvent the wheel all the time. Lots of things are out there. And then healthcare as a partner, you think of public health, you think of medical care, what's the difference? Which one's focused on the individual? The healthcare typically, right? Interested in, diagnosis, treatment, it's that one-on-one care typically. Whereas public health is the population focus. It's heavily focused on prevention. And I know any MDs in here, I don't remember from introductions, in medical school training, I don't think they do much on the way of prevention. Again, it's more the way to think and how to solve a health problem, how to diagnose and then how to treat. There's been a push lately for things like a nutrition class to be given, for medical students. I'm not sure with nursing students. I think we have one RN, is that right? Did you have nutrition in your training? Did not? Okay. Certainly talking about, the benefit of physical activity, exercise, and how to mitigate a lot of health issues. So typically, we said healthcare is focused on the individual, diagnose and treat, whereas public health is a joint effort with all those partners, and it's population focused. And again, this sort of summarizes what the difference is between healthcare, public health. Okay, who are these public health professionals? These are some job titles, and if you want to pull this out, these are some of the typical, occupations that you're probably familiar with, heard about. And these disciplines come from, if we go back to this chart, we see public health in the middle. Typically, when you think of the occupations related to public health, it's broken down by the way academia sort of addresses this and their degree programs. But we see health promotion, we see public health policy, health administration, epidemiology, biostatistics, and environmental health. So these are typically the fields of academia that relate back to the field of public health. All of these people would be public health experts. And then as they graduate, we see these different kinds of, job titles per se. But quickly, I want to just talk about what do we mean by the different areas of public health. Health promotion, that's my field, that's my formal training. That's an area that encourages people to make healthy choices. How can we just change the environment so it's more conducive to healthy behavior? And a lot of community-wide initiatives. Okay. Biostatistics, that's for the people that like math and have a good sense of numbers and working with numbers. But biostatistics is the use of mathematical and scientific methods to determine the cause of disease and identify health trends within communities, and even look at temporal trends or changes over time. Environmental health is prevention and control, injuries, disabilities related to our interactions with the environment. Like the examples we've mentioned, cleaning up garbage, cleaning up sewage, standing water. We hear a lot about don't let water stand because it breeds mosquitoes and West Nile virus and all of that. Northeastern Oklahoma, remember the chat piles from a few years ago? Big study, sort of went wrong from a public health perspective. Everybody know chat piles, what that is? It's lead, and it was from the oil industry, and they didn't clean up, and so the kids were playing in these piles of like chat, kind of small rock, dirt piles. Well, there was lead in that, and so the kids were getting respiratory problems. So they shut down that study, made sure all the children got the help they needed, and sort of just closed off a big area, unfortunately, in Northeastern. We all know about lead paint, kids eating sometimes a chip of paint, mold, a lot about mold these days, and even secondhand tobacco smoke comes in this area. So that's the field of environmental health. Epidemiology, we've mentioned this, we've talked about the father of epidemiology, but this is a study of what causes disease or injury. What are the risk factors? Who's at risk? How can we prevent further incidences of things? So I like to think of epidemiology as something that informs all those other areas. If we didn't have epidemiologists, the people in health promotion wouldn't know what the risk factors are. We wouldn't know, if we wanted to treat heart disease or reduce the incidence of heart disease, we know to work on nutrition, looking at fats in the diet, exercise, and on and on. And the other thing about health promotion, again, you're not working with just that individual who might be susceptible to heart disease, but it's working with the families, the communities. One person alone is very, very difficult to change behavior, so any families involved. So epidemiology is very, very important. And a lot of epidemiologists are working in tribal epicenters or Southern Plains Tribal Health Board. So there's our specialists and can really help us with a lot of information. All it takes is looking at their website or a call. There's also a technical assistance, plug for the health board. If you need technical assistance, you can fill out that request, they direct it to the appropriate person, and then you will either get the package with the numbers you need, or they will teach you how to do it, okay? And then the last two areas on this red diagram, the health administration and policy, public health policy, health service administration. A lot of times you see those two areas combined, say, together in a program of study. Health services administration, it would be for those people who are business-minded. They have a good knowledge of how to manage people, manage businesses, combining policy, business, and science, managing human and fiscal resources, in an organization. And a lot of individuals who maybe run clinics hopefully have an expertise in health services administration or a business-related degree sometimes. And policy, again, as I said, it's a lot of times it's in the same program with health services administration, but it's cross-cutting. It involves things like our seatbelt laws, no smoking policies, taxes on junk food. We don't know if that'll ever happen, been talking about it for years. Policies about breastfeeding in terms of availability, breastfeeding rooms available in public places, restaurants, restrooms, changing tables, all those kind of things, and sanitation. So back on the diagram, how many people in here have either a bachelor's or a master's degree say in a public health field. Did anybody in here, you do? What was your area? Okay. Okay. It used to be basically graduate programs, but now even OU has an undergraduate program, so even bachelor's degrees in public health. And in the state of Oklahoma, gosh, there's 2 or 3 accredited programs in public health where you can get an MPH or a doctorate of public health. So if you're at all interested, I'd be happy to visit with any of you. And then you can also look at the websites, for the different schools and read about their programs. University of Central Oklahoma has a dynamite program as well. Okay, any questions on the disciplines, public health disciplines? Okay. Okay, this is our last section. Last section. We're going to talk a little bit about determinants of health. There are some things we can't control, with our physical environment. Our genes and biology. We're born with the genes that we got from our parents. Where you live, you've heard of people in our zip code studies, where people live, different illnesses or things affect them in a greater proportion. For example, people that live in large cities where there's more pollution from vehicles and so forth, a lot more respiratory problems, asthma in kids and things like that. Our health behaviors, a lot of the things that we choose to do or not do. Do we choose to eat a good diet? Do we choose to work out, exercise, even just walking? To a certain extent, you can choose where you live, where there's maybe not so much stress. I just saw in the news today in New York City this morning, did you all see all that rain that's coming in? And for the city of New York, people couldn't get to work, and just the chaotic nature of a huge city like that, and then when the subways go down and buses can't run, that just seems like that might be a very stressful place to work. So to a certain extent, you can choose what state or the geography or the geographical area you might choose to work in. Okay, this pie chart has those same determinants, our genes and biology, health behaviors, medical care, and so forth. The biggest area is that purple one where we have the most control, okay? Very little control, genes and biology, to a certain extent, health behaviors, medical care. And, but if you look at health behaviors from the bottom of this red circle all the way to the bottom of the purple, that's about 75% of the chart. This is about a fourth of it, 25%. So what's that telling us? Who's in control of our health? You are. Everybody's in control because you can have a say, health behaviors and so forth. Not so much medical care, but if you're in a medical care situation, hopefully you adhere to the doctor's advice and so forth. But as we just mentioned, not a lot of prevention takes place in a clinical setting. How many of you have maybe wanted more information? They go, here's a pamphlet. And do you read those things? Maybe. Do they give you a list of resources or programs? Now in our tribe, there is this program, you might want to look into that. May or may not. But hopefully, the health department people are in connection with the medical care. Lots of things can be worked out with referral systems, especially tobacco. So if you're seeing a clinician, then hopefully they know enough about some resources and say, okay, there's a smoking cessation program. Why don't you go see this person? Okay. And hopefully within tribes, we try to establish, that better working relationship So, you know, not the silos, but so the right hand knows what the left hand's doing and vice versa. And so you have all those resources at the tip of your fingers, and the clinicians use those, and vice versa. What are some things that your tribes maybe are doing or could do, or in your communities? What are things that you're doing or could do to think about more positive public health behavior? There's probably a lot of things that you don't even think about that's happening already. How many of you have playgrounds, safe playgrounds for your kids? That's public health. How many of you have walking trails or biking trails? How many have some signage? If people want to walk a mile, you have some signage up. The Cheyenne Arapaho tribe recently completed one of their trails, and it goes around their buffalo pens. So they've got a lot of signage, educational signage around, and it's just a very pleasant walk. Okay. Street lights. Have any of you ever worked with your city government? Maybe, you know, it's not safe in the evenings, or kids want to be outside and play, but there's not enough street lights, or a family wants to go for a walk. Putting in street lights, that's a public health issue. And again, you don't typically associate, you know, all those kinds of events. Safe parks. Can any of you think of other things that you've already done or could do or working on?
We're working on, we just started adding a program to where we provide transportation to the
Yeah.
store, so we can have more choice of quality food instead of just what's
Okay,
around the corner. So
right.
we're providing transportation for that.
Okay. Anybody doing gardens, community gardens? Again, the CNAs, they started porch gardening and passed out like tomato plants and then some sage and doing different things. So people could just have a porch garden. So, and those are some of the things in our Good Health and Wellness program, some of the things our partners are doing. Any other ideas or things you're doing? Do you work with CHRs? You know, there are lots of things the CHRs can be doing, maybe as they're transporting people. Okay. Are they taking their medicines? Lots of questions to be asked. And I know there's some CHR trainings available so they're better equipped to answer, you know, some questions about medicines and so forth, or their eating behaviors, things like that. Okay. So anyway, those are just some examples of determinants of health. If we go back to the pie chart, if we can control approximately 75% of what happens or how we interact, and then the 25% medical care, there's a lot of work to be done, right? I always told my students, you're always going to have job security, because none of these are problems that are ever going to go away, sadly, you know, like in any of our lifetimes, probably. So there's so much work to be done. Okay. And then this just sort of summarizes again the areas we're talking about, relating back to some of the core sciences. Sometimes the word informatics might be used in relation to health promotion and so forth. So public health in Indian country, you're probably all familiar with the medicine wheel: physical, social, spiritual, mental, emotional. And why is each block of the circle even? Because all the areas are what? They're balanced in harmony, right? So if you haven't seen the medicine wheel, it's nice to have pictures, you know, in your offices and so forth. But a balance between all the four areas, okay? And then this slide, so this is tribal public health. All kinds of things, even signage. How many of you have signage in your tribal language, or maybe both? that's a lot of things that our Good Health and Wellness partners are doing. They'll have it in the tribal language and then English. There's all kinds of things that sounds like you are doing. One of the best ways to keep abreast of all this and all the happenings is share ideas with one another. Go to conferences, go to trainings, and network. You know, as I said earlier, you don't have to reinvent the wheel. For about every illness or injury you could think of, there are programs available. There's literature available. And like I said, a lot's in the public domain, so a lot of times you may have to ask, but you can put your own logos on it. Okay. Also, want to encourage you to talk about your own programs. If you have a chance to present, say just in your community, or maybe present something to Tribal Council, please take that advantage. If you have newsletters or newspapers, put articles in there about what you're doing. You know, we gave the example, if people don't know the programs are there, they won't know to even ask about them sometimes. So, you know, publish what you're doing. And one of the things we've done in our, when we had our centers at the university and so forth, we had workshops on how to write an abstract. Talk about what you're doing, submit an abstract to a conference. Go to the, as Nick Martin mentioned in April, the Tribal Public Health Summit. It's going to be in Tulsa this year. Submit an abstract because they're usually begging for submissions, okay? And an abstract you can look online again, but you say, what's your title? What were your objectives? What'd you do in the program? What are some of your results? I mean, it's pretty simple, really. And you get to a conference and you've all been in sessions where you probably learned something or you had a takeaway message from something you learned at that conference. So, you know, don't be just the listener, but get in there, participate, talk about what you're doing, spread the word, be creative. With all the tools that you have anymore, just with the computer, AI, you can develop all kinds of nice, you know, signage, literature for your areas. And then, you know, write grants. How many of you do? I asked earlier, a couple of you said you write grants. How many of you would like to or get involved? Or you say, gee, I wish I had $50,000, I could do this. Well, you could probably write a grant and get that, okay? You can always start out locally. Again, the health board puts out announcements about, you know, grants that are available. And one thing, the health board never competes with a tribe. So if a tribe says they want to go for something, they let you do that. They won't try to take it away, okay? Also, a very important website, grants.gov. If you go to grants.gov, you can just enter a topic and you'll see things that are available. And there are things like just training grants. Say you want to put on a diabetes training program. Well, there might be some funds available to do that. So not all grants are like National Health of Institutes or NIH, you know, funded, where you have to do sophisticated research, okay? There are all kinds of training grants, just program grants. So all you have to do is just ask, reach out, you know, to the resources that you have. And even other tribal epicenters. I forget how many there are. Is it 8? Not, does anybody know? 12, you think? Epicenters. And they're all online. You can just Google tribal epicenters and look at other programs from other states, other areas. Very, very helpful. Okay, so our course summary. These are some of the things that we've talked about. Hopefully, I hope you've learned something or that you feel like, yeah, I've gained something. There will be one more offering if any of your colleagues are interested. I think it's October 13. So Kristen stepped out, isn't it? 13th, yeah. And it's a Friday morning as well, and it's so going to be here also. I'm at the health board quite a bit, so Kristen's cards are on the table. You can reach out to Kristen. She can get questions to me. I'm available a little bit longer today if anybody has any additional questions.